Welcome back. Well, today I am joined by Dr. Christopher Baker, who is the Director of Interventional Neuroradiology at Pickup Family Neurosciences Institute at Hoag. Well, Dr. Baker, thank you so much for joining me today.
Thank you for having me.
Now, there's a variety of things that can happen to someone when they are experiencing a stroke, and there's a lot of treatments that are out there to help them. But before we get into what is offered at Hoag, please tell me a little bit about yourself.
Well, I grew up on the East Coast and went to med school there in New Jersey. And then after my residency in Maine at Maine Medical Center, I did my fellowships at Stanford, just up the coast here in California. Mm-hmm. After finishing my training, I went back to Maine, and we were there for almost 10 years before coming to Hoag about 4 years ago.
Okay.
And I don't think we're ever going to leave.
I can't blame you. The weather here is just too great, even though we did have some rain, but it doesn't rain that much in California. So tell me, were you always in the stroke area, or did you study other things?
My primary focus in interventional radiology is with stroke and brain aneurysm. My first fellowship was in regular interventional radiology, which deals with everything other than the brain and spine. But my second fellowship then went on, and so that's become my focus, really.
Okay, gotcha. Now, tell me a little bit about, what a stroke is and how would someone know that they're having one?
Good question. A stroke is, in a sense, it's kind of like a brain attack. And the majority of strokes that happen are caused because of a lack of blood flow. Mm-hmm. Some strokes happen because of bleeding in the brain or around the brain. But I'd say 85% are the lack of blood flow type.
Okay. And so what would cause a lack of blood flow?
It could be anything such as narrowing in an artery, like plaque that has built up over time. It could be a blood clot that forms in other parts of the body and then gets carried up to the brain with the blood flow. And those are the strokes that have a big clot that's gone to the brain are the ones that I primarily deal with.
Okay. So, but you could have mini strokes, right? But and not have those particular types of circumstances.
Yes, and the majority of strokes that occur are little strokes that only affect a small part of the brain.
Okay. Now, could you have mini strokes that lead up to a larger one?
You could, okay. Yeah. And
okay.
In a sense, that would be kind of like giving you warning signs that you need to take care of this before you have a big one.
Okay. Now, what are some of the signs that someone is having a stroke?
Weakness on one side of the body. It could be loss of sensation or even simply numbness, tingling that kind of is there for maybe 10 or 15 minutes and then goes away. That would be more of kind of the warning signs, like I'm having stroke symptoms without actually having the stroke. Mm-hmm. Or it could be loss of the ability to communicate, not being able to form words, not being able to understand what people are saying, things like that.
Okay. Now, one thing that you said at the beginning there was, you would have some sort of numbness on one side, but isn't that also sometimes what you would feel if you have a heart attack?
Sometimes, especially if it's on the left side, you might have that sort of sensation, but with a stroke, more often than not, it's going to involve the entire side and one side of the body,
okay,
as opposed to just kind of in the arm.
Okay, good to know. So what are some of the things that Hoag can help with in regards to some of these symptoms and issues that someone would have?
Well, anybody that comes into the emergency department with symptoms that look like a stroke would be first evaluated in the emergency department. And once we have an examination where we find neurologic symptoms such as weakness, loss of speech, loss of awareness of certain parts of the body, loss of sensation, balance, all those different kinds of things, they would get a scan of the brain usually a CAT scan or a CT scan to look for a sign of a bleed in the brain or around the brain, or any evidence of loss of blood flow to part of the brain. One of those types of, one part of that scan highlights the blood vessels, and that's what allows us to see if there is a big clot that is there.
Okay.
Yeah.
Perfect. And then once you've diagnosed somebody with a stroke, is it immediately taken care of, or do you have a process where they need to wait a period of time, or how does that work?
We take care of them as soon as we can. For every minute that the brain is without blood or without oxygen, about 2 million brain cells die.
Wow.
Yeah, so it's a very, very fast process. And so we want, as soon as somebody comes in and we identify stroke symptoms, we rush them to imaging. And once we have a better diagnosis of what's going on, then we can then proceed to the different treatment options.
Okay, good. Now one thing I've heard, not so much with stroke, but maybe it is similar, like women may tend to brush these particular types of symptoms off as, well, I don't need to worry about it, it's because of this or that. Is that the same with a stroke? Because I know with heart disease, they do that as well.
I think a lot of people tend to do that. And I don't know if it's women more than men. But we have stroke awareness events, and there's always a stroke awareness month where we try to inform people as they look, if you're having these sorts of symptoms, just go, because the potential consequences can be devastating. Okay.
Yeah, there's some acronym here that I saw in my notes. It's BEFAST. What does that mean?
So it's the FAST stands for face, arm, speech, and time. So those are the three ones. The face, the arm, and the speech are the things that can often indicate a very large potential stroke.
Okay.
Right. Where you have weakness on one side of the face or the other, loss of the ability to speak or communicate, and weakness in the arm and leg.
Okay.
And then the time obviously is the big factor.
Right. So don't fool around. Just get right in as soon as you can if you're feeling something.
Exactly.
Okay. What are some of give me some examples of patient outcomes? Like, give me an example of a patient that's come in and how successful it was when they left.
I can actually give you an example of a patient that came in yesterday morning, very, very early, when I was on call, and they came into the emergency department after having fallen down. They got up in the middle of the night to go to the bathroom, and they fell down because of weakness and loss of speech. And so the patient's wife alertly and appropriately called 911, and the ambulance brought them to the hospital very quickly. We were able to diagnose a clot that had gone up to the brain on the left side into one of the larger arteries, with almost the entire half of the brain at risk of becoming permanently injured. This would be obviously a devastating stroke and potentially life-threatening. Fortunately, on that initial scan that they did in the emergency department, they did not see any evidence of permanent damage, just not enough blood flow getting to the brain, and that's what was causing the symptoms. So then my team and I rushed in, and we were able to remove that clot. And by yesterday afternoon, when I had a chance to go back and see him, his symptoms were essentially gone.
Wow.
Yeah.
That is really quick. And then how long before they could go home?
Oftentimes when we get a result like that, they're going home within a few days.
That's great. Wow. It's amazing what our technology has done over the last, probably 5 to 10 years. Don't you feel it's increased to where you can solve these issues quicker?
Oh, definitely. Definitely. There was a lot of research has been done over the years trying to find the best way to treat these strokes. And about 6 or 7 years ago, there were several papers that were all published at the same time that dramatically changed our approach to these large clots that go to the brain, and it has really made a difference in a lot of patients' lives.
Yeah, and that's great. That's great. Well,
Yeah.
gosh, thank you so much for the information. It was very nice to meet you.
Nice to meet you too. Thank you for having me.
You're welcome.
All right.
And if you want more information about what we've just discussed, you can go to hoag.org. We'll be right back after this.